Hello, dear colleagues. Thanks a lot, Mr. Chairman and Co-Chairman. Nice to meet you, and I am glad to join you in this session. I am Professor Ghazi Farhan Haji, President of Iraqi Hypertension Society. Let me first express my sincere gratitude for giving me the opportunity to share this complimentary comprehensive conference. Today, I will shed a light about the management of hypertension in Iraq. I'm going to discuss and focus on challenges and proposed action. Hopefully, at the end of the day, share experience and expertise that will be valuable additional to our deepening knowledge and raise care of our patient and emphasize the role of society in management of hypertension strategy. First of all, this is my disclosure. I highlighted for the most important 8 challenge and expose providing Iraqi data. Lastly, dedicated the role of Iraqi Hypertension Society. Challenge number 1, still we have a limited in data in the prevalence of hypertension and lack of evidence in subgroup like prevalence of hypertension in children, young, women, and elderly. Also, we have a lack of evidence in prevalence of control, adherence, and sympathetic overdrive on those with diastolic hypertension and prehypertension. The history of hypertension in Iraq started in 1979 with a big registry. At that time, the cutoff value was 60/90, and the prevalence of hypertension at that time was 12. Then the paradigm shift in 2015 by big study did by Minister of Health, and at that time the cutoff value 140/90 and the prevalence of hypertension was 35, and there's a fairly close relation between the men and women regarding the prevalence. There's a nice study did in Basra, south of Iraq, concluded that hypertension was seen in 90% of diabetic patients in Iraq. This interesting study published in 2020 by Iraqi Hypertension Society found the prevalence of hypertension in Iraq around 49%, and the incidence of hypertension toward younger age. Also, this is a nice study that in Kurdistan, Iraq found that the prevalence of hypertension around 54%. What we need to do, need national survey, need sharing the data with near region countries, need to encourage postgraduate students to write paper to fulfill the gap in the evidence. Challenge number 2, still we don't have own guideline or roadmap, still adopted an international guideline like ESC, ICC, NICE, and other. Our population in Iraq differ in lifestyle, in drug consumption, salt intake, and follow-up. I believe the International Society guideline, hypertension, it is more easy and applicable and should be adopted in Iraq. From this figure shows that the ISH and European guideline differ in the target of population and treatment strategy and treatment target. What we need to do in Iraq, Iraqi guidelines need MENA region at least guideline, at least Arab region guideline, Gulf region guideline. The Iraqi Hypertension Society in work with the Minister of Health to publish update roadmap of hypertension in Iraq. For the time being, we don't have any guideline in Iraq. Challenge number 3, that one of the most criticism, it's the poor control of blood pressure, non-adherence to drug, diet, sport, and hesitancy in diagnosis and start treatment of hypertension. Only 7.9 of population in Iraq on the medication and well controlled for hypertension. This analysis study in Nasiriyah, south of Iraq, found that only 35% were well controlled blood pressure. And from the north of Iraq, this analysis study also did in 2015, found that the 55% were non-compliant to the medical therapy. And the major factor for non-compliance is forgetfulness. This relation between the knowledge, illness reception, medication. The study did in Babylon in 2021 concluded that the rate of medication adherence was affected by many factors, including lifestyle, diet, number, and side effect of medication and complication that caused by the hypertension. As you know, non-adherence is a multifactorial phenomenon, might be related to the patient, might be related to the therapy factor, might be related to the condition factor, healthcare system, social, economic factor. What we need to do for this challenge, need educational trips, early orientation and follow-up, and a change in Iraqi healthcare system. Challenge number 4, hypertension is a chronic disease, not transient. The goal is not to reduce to the target, but to prevent the complication, mortality, morbidity. Still, the choice of combination therapy, dizzy. The cost of a drug is still one of the main barriers in management of hypertension. Still, we face generic versus brand as a financial issue in Iraq. And still in my country, over-counter and parallel drugs is a national problem. This is a list of price of drugs in Iraq. Atican around $16, lisinopril $11, amlodipine $10, and etc. This is an interesting study under title The Compliance of Hypertensive Patients to Their Therapeutic Regimen in Health Facilities in Baghdad City. And this study found the reason for irregular drug intake might be related to the cost, might be feeling better, the patient said, because some patients said ineffective. They stop the drug because of side effect. They don't use the drug because to avoid addiction, and use alternative drugs like herbal medicine in most of Iraqi population. And conclusion of the study, the compliance of hypertensive patient was highly associated with old age, high level of education, those would use monotherapy, those who use single dose, low cost therapy. As you found, the generic and brand, those drugs are the same ingredient but differ in the price. What we need to do in Iraq, update our knowledge, avoid inertia, work together to reduce the price and control of entrance of drug in our country. Personally, I believe the brand efficacy is not less than generic. Challenge number 5, alternative therapy, use of herbal therapy, and wrong belief. This is an interesting study under title of use complementary and alternative medicine in Iraq, and concluded that complementary and alternative medicine, particularly biological-based therapies, was prevalent among hypertensive patients in Iraq. And the most common herbal use in Iraq, garlic, was the main type of herbal that have been used around 40% of Iraqi population. This study did in Al-Basra. What about wrong belief? Our population in Iraq believe the headache is the most prominent symptom and one of the target of that indicator for high blood pressure. They believe lemon juice reduce the blood pressure. They believe that cupping reduce the blood pressure. They believe that chicken feet reduce the blood pressure. What we need education in different levels. Challenge number 6, salt consumption. This nice study in north of Iraq found that the sodium content in 1/3 of studied bread sample higher than accepted limit. And what we need to do, salted with 1 whole, and insist to advise the restaurant to do it. And green pepper alternated to the salt substitute, as salt substitute. Potassium salt is recommended. Himalaya salt not recommended because it is like the salt, original salt. Challenge number 7, diagnosis of hypertension, different devices, no calibration. As you know, there is a different devices in our market in Baghdad, in Iraq in general, without clinical or technical validation. What we need own validation protocol, technical and clinical, supported by Iraqi Hypertension Society and Ministry of Health, and curve size available for pure cost with each device. And finally, challenge number 8, lack of sleep, heavy work, noise, stress, disaster, pollution, panic status, all as a causes of hypertension. And this interesting study did in Baghdad, in Iraq, nearly 2/3 of female physicians suffer from the stress and hypertension. And noise role in hypertension found the study that the occupational noise pollution is recognized as a physical factor in increased systolic and diastolic blood pressure. This is studied in the north of Iraq. The role of Iraqi Hypertension Society in community, and I think that educational wise important because we do and a lot of social activity regarding the awareness and education of our population. Also, we celebrated in the World Hypertension Day every year, and role of Iraqi Hypertension Society in the community interchange information with doctors from different levels through holding a society symposium or conference collaborated with other society or Ministry of Health. In collaboration with Ministry of Health, sharing to deliver the hypertension roadmap and assess the patient health care provider relationship, arrange for established hypertension clinic, and adopted an addressing article for hypertension by journal. Our message should be update our knowledge and wait promising news. I recommend to depend on an adopted International Society Hypertension Guideline in Iraq. Start with combination therapy is the best treated and controlled blood pressure in Iraq. Still hypertension and pre-hypertension are underestimated in Iraq. Finally, health does not always come from medicine. Most of the time, it comes from the peace of mind, peace in the heart, peace of the soul. It comes from the laughter and love. And thank you.